The most shocking fact about mitral regurgitation is that a common heart attack, myocardial infarction, can cause a critical piece of the heart's machinery to physically snap, leading to instantaneous catastrophic valve failure and life-threatening emergency. The leaflets of the mitral valve are anchored to the heart wall by the tiny tendons called chordae tendineae, which are in turn attached to small muscles called papillary muscles. Think of it as a parachute system. The valve leaflets are the canopy, the chordae are the lines, and the papillary muscles are the anchors holding it all down. So a heart attack, particularly one affecting the inferior or posterior wall of the heart, can cut off the blood supply to one of these papillary muscles. The muscle tissue dies under the immense pressure of the contracted ventricle, can rupture or snap. When this anchor breaks, the chordae go slack and the valve leaflet they were holding becomes a flail leaflet. It's no longer tethered and flaps uselessly into the left atrium with every heartbeat. So this creates acute, severe mitral regurgitation. So a massive high pressure jet of blood is suddenly blasted backward into the small unprepared left atrium. This pressure in the lungs skyrockets, causing flash pulmonary edema and severe cardiogenic shock. So it's not a mechanical failure, not an electrical one. This isn't an arrhythmia, it's a structural blowout. It's the equivalent of a critical engine part snapping in half while the car is at full speed. So the domino effect is really terrifying. A single blocked artery, no heart attack, myocardial infarction, leads to a dead muscle, which leads to a snapped tendon, which leads to a blow valve, which leads to lungs filling very quickly with fluid. It's a catastrophic cascade of events. This condition is almost universally fatal without immediate intervention. The patient must be rushed to the operating room for emergency open heart surgery to repair or replace the mitral valve. But, the new loud, harsh murmur a doctor hears at the bedside is the sound of a mechanical disaster. Get it? Good.